Joining me now is Representative Joe Atkins to talk a little bit more about what these MNsure rates really mean to Minnesotans. Thanks for joining us. We appreciate your time.
My pleasure to be here.
So let's begin with the MNsure rates that were recently released. One of the states, we are, of all of the states that recently released their rates, ours did come in as essentially the lowest. So, when we interviewed you a few months ago on Capitol Report, you said, of course, you predicted that opening up the market would drive down costs. So what was your reaction? How would you grade the rates that were released?
Well, I wish I could say it was some big surprise, but I mean, this is really what competition does. It drives down prices and it drives up quality. And so I was hopeful that we'd see low rates. And they weren't essentially the lowest rates. They are the lowest rates by a pretty wide margin compared to most of the states that have filed their rates.
And yet there's still some Republican pushback on this. One person, Representative Joe Hoppy, stated after Friday's release, "Today we learned many hardworking Minnesotans will be forced to pay more for health insurance under the exchange than they do on the private market here in Minnesota. How does making health insurance more expensive encourage more people to get insured?" What are your thoughts to those comments?
Well, unfortunately, I don't understand them. These are the lowest rates in the country. There's no asterisk, there's no caveats. They're the lowest rates that have been filed anywhere in the country. And so I'm not quite sure what Representative Hoppy meant by that. But it's good coverage, in some cases great coverage, at the most competitive rates anywhere in the nation.
And I was reading that comparing it to the private market is kind of like comparing apples to oranges. How is that? And do you think these rates really do compare with what's out there in the private market?
Well, you got to keep in mind that as of 2014 now, none of these insurers can turn somebody away because they had a pre-existing condition. And so you've got, and the only factors that they can take into account are things like age and whether you smoke. So it's a little difficult to compare. Right now, you apply for health coverage, you can be turned down for any number of reasons. And these plans, you're guaranteed to get coverage, and you're guaranteed to get it at a very affordable rate. In fact, I think one was lower than $91 a month. That's really good coverage at a really good price.
So, Representative, what's your reaction to news that companies like IBM in particular, it plans to move its retirees off company-based insurance and onto the exchange? Should taxpayers, in your opinion, be concerned at all that we might be picking up the tab for things that were normally paid for by private companies?
And I'm so glad you brought that up, because all we're doing is serving as the market. We're like Target. We're just putting things on the shelves. The products themselves are still sold by Blue Cross Blue Shield or by Health Partners or by Medica or one of the other carriers that provide the coverage. We just provide the market to bring that healthy amount of competition. So to the extent that IBM or anybody else wants to have folks shop for coverage, they'll have that opportunity. But it's not government-issued coverage. It's not government-run coverage. It's just a good, healthy marketplace, a vibrant marketplace.
And we were talking, we essentially talked about an employer who's making this decision. What about an employee who might want to opt out of employer-based health care, who finds a better deal on the exchange? Are they kind of designed, or do you think that it might be one of the benefits that they're going to compete against one another, the private and the public marketplace?
I think, Julie, that's the whole point, is to have competition, and that competition, regardless of what you're shopping for. In this case, it's, health insurance is kind of complicated for a lot of folks, and it's kind of frustrating too. But hopefully this will, in a very straightforward way, enable consumers to kind of level the playing field with the sellers of the product. Get a good product that they're shopping for, and one that fits their budget, and a high quality one at that.
And now the exchange launches in less than a month. How is the outreach going thus far? What's your opinion?
Paul Bunyan is making some real headway, I think. I mean, I was a little, I didn't quite know what to make of that. It's sort of farcical, but the number of folks talking about health insurance as a result of this Paul Bunyan outreach effort, I think is remarkable. It seems to be going really, really well, and I think I'd imagine we'll find out later today. Actually, we've got an oversight hearing from MNsure. What sort of numbers are being driven to their call center and to their webpage, but I think it's going to be significant.
And there was an article in the St. Paul Legal Ledger recently that the Stair Strip Foundation intends to, quote, raise holy hell about the fact that it doesn't see that there is anybody doing outreach. No group was selected that specifically targets African Americans. Do you think that's valid, or do you think that there were some groups selected that can target that audience?
Well, I think there's two things. Number one is that the final selections haven't all occurred yet. My understanding from the folks at MNsure at the Health Insurance Exchange is that they're still going through the outreach efforts. So I don't know whether or not Stair Step in particular or any other organization is going to be on the final list or not. And in addition to that, I think and I would hope that all of the organizations that have made it through the process thus far would be not reaching out specifically based on color, but to reaching out to all Minnesotans and hopefully spreading that word to everybody that could benefit from a competitive place to buy your health insurance.
Another demographic that tends to not buy into health insurance is essentially young, healthy people. How do you get them to sign on?
You're describing my sons. I was actually having this conversation. They're not quite beyond where they would lose their coverage through me. They're in their early 20s. One's 20, one's 19. But it's something that, they're all immortal, so they don't really think about it too much. But I think as they get to be into their mid-20s, it's one of those sorts of things you should have. A long time ago when I was in my mid-20s, it was something that it was really a question of could I afford it? And at this point, with $90 a month, or perhaps, and that's before the tax subsidy, or the tax credit from the feds. If you could get coverage at a modest rate, perhaps less than half of what you pay for your cell phone each month or what you pay for your cable bill, I think you're much more likely to buy it than if you can't get it at a reasonable price.
One last question. Could you grade these rates? Graded A through F. What grade would you give the rates that were released?
When you're number one, how do you give it anything but an A?
All right, with those words, Representative Joe Atkins, thank you for coming in and talking with us. We appreciate your time as always.
You bet.